Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And I'm Melody Acosta.
And this is A Pod Full of Pediatrics. Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge.
You did that so well.
Yeah,
thank you.
Natural. And this is one where we talk about infant and toddler nutrition.
And toddler nutrition.
Nutrition.
It's my favorite topic.
Yes, and so
that's why we invited her, because it is her favorite topic.
And we don't love talking about this. But Melody, tell the audience about yourself.
Okay. I'm a registered dietitian. I work for Providence in Hood River, and I've been doing the work with toddlers and infants and families for around 30 years. So I'm quite old.
She knows what she's talking about, and she stays current. So it's fresh, new information.
Well, and you're going to be a doctor, too. So.
Right. I'm working toward a doctoral degree in clinical nutrition.
Yeah, which is exactly why we wanted her on this program, because she is very, very knowledgeable, and which helps us. So.
For sure. And feeding the first year of life isn't so important, right? Because this is literally like the building blocks for the rest of your life.
Mm-hmm.
And it's really a critical time for babies to get that human contact, but it also is a time for crying. And just because they cry doesn't mean they're hungry.
That's right. It does not mean they're always hungry. You have to respect a child's appetite. And overfeeding is really easy to do, even at the earliest of ages. And sometimes when they do get overfed, they end up spitting up.
And sometimes they'll spit up even when they aren't overfed. Just like their tummy is really tiny. You said
really small. It's when they're born, their stomach is about the size of a marble.
Isn't that crazy?
And then,
how do you fit
tiny.
20 mils in there? Yeah, the size of a marble.
And I will also say that little pyloric sphincter that kind of is supposed to keep all that food down, it's really not working so hot.
No, it needs practice.
Yeah, it's a muscle. They don't have very many muscles right now, so this doesn't work well. So babies spit up, and that's normal. But we're going to talk, and we're really talking about normal. Full-term infants, typical full-term infants, not children with disabilities or premature infants when we talk about this infant nutrition. So we want to really, or even the toddler nutrition. If you have a child who has healthcare problems or is premature, don't listen to this one.
Well, you can, but just don't pay attention to it.
Yeah.
All right, so let's start at the beginning. From birth, babies need either breast milk or formula, and that's it. Nothing else.
That's it. Until 6 months of age, at least, no water, right? Mm-hmm. So you don't need extra anything.
Breast milk and formula has it in there.
They have a ton of water in there.
They have a ton of water in there. And when it's really hot and you're breastfeeding, your breast milk actually contains more water, which is one of the great things about breast milk is that it changes a lot based on what's going on in your life and how old your baby is.
Well, we talk about, and we've talked about this before, breast is best, like everyone talks about that. It is the important part is feeding responsibly to your child, and that's the most important. And infant formulas are very well regulated and very safe in the United States. So while we want to encourage breastfeeding, if there's reasons why you can't breastfeed or the baby can't breastfeed, formula is a great alternative, and it works very well.
Mm-hmm. Yes. So whether you're breastfeeding or formula feeding, it's important to pay attention to the baby's pace.
Right.
Because the baby will let you know when they need to take a break or when they're done. And even a very young baby will push away a bottle with their hand when they have had enough, or they will indicate that they need to take a break by flaring their eyes.
Right. Read those nonverbal cues of something just happened. Take a break, reassess,
Slow down.
Yeah.
But the good part about breastfeeding and bottle feeding, and the important part of it is that it really is about skin to skin contact, whether breast or bottle. And you really want to make those things like eye contact, singing, humming, swaddling, really being attentive to their cues and responsive to that. That actually is super important for all of bonding and brain development. Again, no matter if you're breastfeeding or bottle feeding.
Right.
And obviously, say breast is best because it's convenient, it's low cost, it's more easily digestible, like as Melody was saying, it fits your baby, it's designed for your baby, and will change with the mom's diet, and it also will change as the baby grows.
And the big thing with it is that we really can't replicate in any type of formula, is it offers immune protections that really are based on what that mom and baby are experiencing. So if they get exposed to something, mom makes immunity to it because often she's seen it before. Those immunities pass to baby, and we can't really get that any other way.
No, no. And that's why it is important for everyone to get their vaccinations. Just a little plug for that.
Oh, yeah, thank you.
We're going to talk more about that. Thank you so much.
Yeah. But the advantage of breastfeeding, keep going on and on, right? So babies who are breastfed for at least 6 months are less likely to be overweight because the duration of breastfeeding is inversely related, it's a very math thing, to the risk of obesity.
And there's also a 40% reduction in the incidence of type 2 diabetes with breastfeeding.
Yeah, and that's great. And so if you know already that your family is at risk for those things, I mean, those are chronic diseases. You know, taking more care to ensure breastfeeding for as long as you can will help to protect your baby.
Disadvantages. There are some actual disadvantages to breastfeeding.
Initially, anyway, it hurts.
Initially, it really does hurt. And anybody who tells you that it doesn't hurt, they're just truly lying. I'm sorry.
Or they're just really tough.
Or they're really tough.
Really
I don't know,
tough
Or they
nipples.
don't have sensations in their nipples. I don't know. Like, whatever it is. Like,
But it
hurts.
does get better. You
It
just
does.
get through it and it gets better.
It is. And it's really not easy for all women and all infants. And sometimes there's maternal diet or medication concerns or immunity concerns, like if mom has an autoimmune disease and is on medicines. Some medicines really you cannot breastfeed through.
Right.
So breast milk is also doesn't have a great source of iron, especially later on. But initially, baby has enough stored from the
Sure.
womb. So
And you know, with breastfeeding or breastfeeding, the baby's going to eat every 3 hours, that's right? So you're going to have to wake up during the night until they gain enough weight to last longer.
and again, like really remember their little belly is really tiny, so they're feeding
So
a
marble
lot.
at first, and then what's
Yeah.
the next stat?
It gets to be about the size of their fist eventually, you know, but it goes from a marble to like a ping pong ball, and then it's around about the size of
So
your
it's the
fist.
size of your heart, because you know your heart
The
the size
baby's
is your fist.
The baby's fist, not your fist.
And so, you know, with breastfeeding or bottle feeding, switch sides, right? We know you have two breasts, you got to feed from both. With bottle feeding, same thing, switch arms.
Right. And that actually is really important for neck, like both muscle in the neck and also really they can flatten their head pretty significantly if you're only ever
Always
using
holding them on one side.
So, so alternate.
Yeah.
It's really good.
So when you're feeding from the breast, you want to keep the baby on the same breast long enough to kind of empty the breast, because what happens later in the nursing is that's when you get that really high fat milk. Like early in the nursing, when the milk first lets down, it has a lot more water content, and the baby will be swallowing really fast,
Chugging.
like that, chugging. And then as you watch, they will kind of slow down, and the milk actually gets thicker and creamier, like later in the nursing. So sometimes if a breastfed baby isn't growing as well as they're supposed to, or if their weight is kind of lagging, just giving the advice that keeping them on the breast longer, or sometimes even pumping off some of the foremilk because it's higher in water content, and getting that extra fatty milk at the end of the nursing will help pick up the weight gain.
There.
Yeah.
And then for bottles, tell us about the different kinds of bottles. People ask me that all the time.
That's a good question, because really glass bottle or a bottle that is plastic but kind of not that stiff plastic, the hard clear stuff that has a number 7 on it. You want to use a bottle that is more opaque, so you can't see through it so well. And then, of course, it's important to not ever put bottles in the microwave.
No, don't. Don't heat them up that way.
Bottles get really hot, and the milk can have hot spots. It can burn your baby. And if you're using a plastic bottle, even the ones that are the flexible ones, you can get microplastic exposure from that. So we want to avoid that.
Yeah.
And then, 80% of mothers expect to breastfeed, but really only about 14% are exclusively breastfeeding at 6 months. And there's lots of reasons. In the U.S., right, we don't have a lot of paid maternity leave.
Right, exactly.
So a lot of moms have to go back to work. But the critical periods for breastfeeding are really that transition home from the hospital at about 2 months, when often people transition back to work, and between 6 to 8 months, due to that. There's often like a little self-weaning that goes on with the introduction of solids. That doesn't mean, and that we're going to really focus on this, that doesn't mean your baby still doesn't need breast milk or formula.
Right, all the way to a year, they need breast milk or formula.
Still need breast milk or formula, even if they wean off the breast part. It just means you need to switch to formula if you're not making enough, or they don't want it anymore.
Right.
So we talk about pumping milk. Like when you go back to work, you'll start, pumping milk until till baby weans off. And when you pump the milk, you can use it still within 2 hours, but after that, you should put it in the fridge.
Yeah, and I do want to say, you don't always have to empty the bottle. I know breast milk is like liquid gold, we call it, right?
Yeah.
Really, every drop counts, which is awesome. But that doesn't mean you force your baby to eat all. If you pumped 4 ounces, don't force your baby to eat all 4 ounces in one sitting if that's not what they want.
Right.
So you can use that leftover breast milk still for a while, and then if freshly expressed or pumped milk can be stored at room temperature for up to 4 hours, and the refrigerator for up to 4 days, because breast milk actually has some really great properties that slow the growth of bad bacteria, and in the freezer for about 6 months, up to 12 months if you have the freezer that doesn't open very often. So
there, and we do recommend vitamin D supplements for the baby if you're breastfeeding. And that's really just because the only vitamin D source is the mom, and we're all vitamin D deficient.
Yeah.
It's just the way it
Especially
is.
here in Oregon.
Especially here in Oregon.
Oh, not as bad as the Midwest. I would tell you, it's definitely a little better here than there.
And don't thaw that milk in the microwave. You really need to just boil water, or you can put water in the microwave, but then you put the milk inside the water that's warmed. Do not put your milk in the microwave.
Right. Put the bottle down in the container of water that's hot.
And then once thawed, you have to use
Shake
that
out.
within 24 hours.
Right. And formula, there's so many choices of formula. I
There
think it's
are.
really become a big market.
So many.
So, when people ask me, what formula should I use? I'm always like, use an FDA approved one. Start
Yes.
there, right?
Yeah.
And all the formulas that are in the store are iron fortified. Well, no, that's not true. Sometimes you can purchase a baby formula that is not iron fortified.
Really?
But we don't recommend that.
No, we don't. But if the baby is younger than 6 months, they could use a non-iron fortified formula if they're, under, let's say 4 months, because they have iron stores from their mother still in their body.
Yeah. We still recommend doing
The fortified formula is
fortified,
better.
and it is fortified means basically just vitamins and minerals have been added.
Right.
And they're the same vitamin and minerals that we are getting through breast milk, and we're just adding them to make sure that they're in the formula, because basically the formulas are made to duplicate mom's milk, right?
Yep.
Right.
Complex combination of proteins, sugars, fats, and vitamins that you cannot create at home.
No.
So do not make your own formula.
No.
Right.
Don't do that.
Yes.
It's really hard, and there's lots of problems that can happen with it. There are different kinds of formulas, though. You don't have to do cow's milk-based
Right.
formulas.
Now there's definitely more safe choices.
Yeah.
And that's a good thing. Even your goat's milk options now are all fortified. If you get, again, an FDA-approved goat's milk formula in the U.S., they're fortified not only with iron, but actually with folate and B12, which is really important because they do not have that in goat's milk. While it is in regular cow's milk, it is not in goat's milk. So it is really important that you pick a formula that, again, has been FDA approved.
So when you go to find the formula that you want, you're going to have a choice of cow's milk based, soy based, or goat milk based formula. There are those 3 different types. And then you get into specialty formulas that are for babies that have special needs or allergies, the hypoallergenic formulas that are a lot more expensive.
They're a lot more expensive. And so again, if you can kind of go with those cows, soy, goats,
Yeah.
again, that have been FDA approved is really, it's great. Those are not as expensive.
And babies are people too. Sometimes they have rough days. Sometimes they're fussy. Sometimes they have weird poop. Don't switch formula just because they had a bad day.
Or because they had a bad poop.
Doctor,
That's right.
because there's lots of decision making that goes into switching a formula, and it's very confusing to a baby's brain and belly
Brain and belly,
to
yeah.
keep switching.
Yeah, they have a very immature gastrointestinal system, and the flora in the intestines is not. It's not like ours. We can handle a lot more.
Yeah. And as we talked about, bottle feeding should just be as interactive as if you're breastfeeding, right? Holding the baby, not propping that bottle up, so you can really watch the baby and pay attention to their cues.
Yeah.
Yeah, propping a bottle has been linked to an increased risk of ear infections, tooth decay, and actually, I think what we worry most about is aspiration and respiratory difficulties. When that just drains into their mouth and it's not being controlled, it's not great for anything, and it can lead to overfeeding.
It can lead to, and also loneliness. You put your kid on the corner of the couch and just prop them up with their bottle so that they're just forced to drink it and they're just there alone.
And you know what? Babies can't go find a new friend.
No,
Right?
they
Like,
can't.
they're
You
stuck
are
there.
you're their best friend, really.
And don't prop it up in the car. Like,
Yeah.
like a lot of times you'll see like parents like propping as you drive. Like, not only that, we now have rear facing car seats. So you're literally not watching your baby while they're eating at all.
Yeah.
And you will hear this throughout our whole discussion today. Watching your baby eat, being a part of that, connecting is actually so important for all of infant and toddler nutrition.
Yeah. Because the relationship with food, as it turns out, is so critical to all other parts of health, and how you do it as a parent, and your parenting.
This is the kind of nutrition I like
procedures.
talking about. Just actually relationships.
Yeah, it is.
Details of the
It's all
food.
about
It's all about just
relationships.
bonding and get social part.
Food should
Yeah.
be fun.
Yeah, it should be fun. Yeah, it
But
shouldn't be
don't make it
anxiety
too
producing.
fun by mixing it your own way. Like
That's right.
mix it as based on the can, right? Like
Yes, prepare it according to instructions.
and 1 scoop to 2 ounces has been the standard mixing for formula. There are some European formulas that may have a different mixing, so you really have to pay attention. And then sometimes we have, premature babies or babies who are not getting weight, mix it differently. But in general, 1 scoop to 2 ounces.
And then in infants less than 2 months old, you do need to boil water before adding it to formula and then let it sit to cool. And that's because not all the formulas are sterile. They've been checked very closely, but they're not all sterile. And so you do need to boil it and make sure you avoid chronobacteria. And then again, use that formula within 2 hours if it's not refrigerated, but you can use it up to 24 hours in the refrigerator.
It's actually recommended when you bring home a can of formula from the store to rinse it under water and wipe it off and dry it before you open it for the first time.
Oh,
Just
yeah.
like because this
A wealth of
It's been
knowledge.
sitting on the shelf, and
That's
who
a
knows
very good point.
who touched it, where their hands
Yeah.
were, the dust, So just rinse it off before you open it for the first time.
That is a
Great idea. And probably just baby food in general.
Yes,
Ah.
actually, all cans and bottles in general. you
Yeah,
should
that's
wash.
actually a
that.
good idea. And then formula or breast milk remain the significant source of calories, protein, calcium, and vitamin D for the entire first year of life. And babies should not drink cow's milk by itself or goat's milk by itself or soy milk by itself before age 1.
Yeah.
So after 4 months is when things start to change, right? We start to talk about complementary feeding, which is like the next step after just having the liquid diet. You get to move on beyond the liquid diet.
So this is, babies change so fast. So the recommendations that you get from your pediatrician when you have a 1-month-old are not the same recommendations that you get when your baby is 6, 7 months old.
That's what makes
That's
it
right.
fun.
Yes, and they change so much during the first year, like we talked about, how it's the only year in your life where you will triple your weight,
Thank goodness.
hopefully.
Yeah, you never want to triple your weight any other time. It's really bad.
Really want that this year. Yeah.
But in that first year, it's really good.
Yeah. So by the time they're 4 months, okay, up to 4 months, they only need the milk, either breast milk, formula, or some combination of those. And by then, they will have changed so much physically that some babies are actually ready to start doing a little bit of spoon feeding. And this, like 4 to 6 months, is kind of a controversial area. right? Because most babies can't sit up all the way by themselves yet. And I used to recommend, wait until your baby's really solid like that, sitting up. Until I went to a conference with the allergy people, and the allergy people.
With a long acronym AAAAI or something.
It's like National Institute of Allergy and Asthma. I don't know.
Yeah.
But they recommend doing a little bit of an earlier introduction so that kids can start diversifying their microbiome, the gut microbiome, and because that gives you so much protection against allergies.
Yes. And I actually I really focus on, when I talk to parents about this, I actually focus on the child. Like,
Yes.
this child
Everyone's an
dependent.
individual.
Yeah, and if that infant is developmentally ready, which means that they are a great supported sitter, they can actually move forward, move back, turn their head away. They are standing
They're watching
Right?
you.
You're eating like with your hand around your food because you're like, oh, maybe you'd like to try this.
So those if your child is that child or that infant, then it's okay to start a little early. But we're starting with things that you're controlling in the sense of spoon feeding, and you're really watching those cues. So that is the biggest thing with it, because this age, it is about taste and developmentally learning about it. There is no nutrition here.
Right.
You are not getting enough that it's going to make a big difference
Yeah.
nutritionally in any way.
Right.
Well, it does make a difference in your gut.
Exactly.
Oh, sorry.
That's your
Yes.
bacteria
Yeah, but I
going.
mean, it's not going to really add a ton of calories.
Right, it's not going to be a lot of
It
calories.
might actually add some iron, which is why the American Academy of Pediatrics still recommends cereals kind of be one of the first foods.
Right, because they're iron fortified.
Yeah, because all of those are iron fortified, and especially for breastfed babies who, again, aren't getting that iron from another source, they recommend starting those. But even now, they don't recommend just rice cereal because that has more arsenic. They recommend more like your oatmeal, and you can try different ones. You don't have to do the same thing every time.
Right.
And that's going to be one of the big things we talk about here is like, give them some exposure.
Give them some exposures. And again, make it fun. Interact with them. Act like you're eating too. If you're not actually eating this, pretend you're eating this.
But
right?
actually do eat yourself too.
Yes, but maybe not the baby cereal.
Don't eat
Because
baby
if
cereal.
your
It
baby's
doesn't taste
eating
that
and
great.
you're just like smoking your cigarette and looking at
Actually,
your
it's your
phone.
phone, right? Like,
Look at your
they're
phone.
like, oh, here. Like, don't do that.
Yes. Eye contact is good.
Eye contact is really good. And if you're eating and they're seeing it, again, we want to model that good behavior of eating, and that you enjoy it too, and that you're trying new things. Like, all that's really important for
Yeah, it
for
needs to be
children.
simple, it needs to be calm, and it needs to be joyful, and they should not be forced to eat.
They
Right.
should not.
Do expect a change in poops.
That's how it happens, right? It's part of the microbiome
Yeah.
of growing is you process things differently.
Yeah, I love actually those first few months of breastfed poops because they don't stink, right? Like, you're
Right.
like, why did I buy that little special like trash can? And then you're like, oh,
This is
now
why
this
I
is
did.
But again, it is important to notice that things are going to change once you start solid foods.
Yes. And even though they're eating some solid foods, it's not going to be all solid food. They still need to have the breast milk
Yeah.
or the formula,
That is their major source of nutrition.
but they don't need to hold their bottle.
No.
You can hold the bottle while you hold them.
You still do that. The bottle doesn't need to be in their seat and in
In
the
the
crib,
crib.
any of that. So
Yeah. And part of this, 4 to 7 months is introducing the allergen foods, right? These ones that are more likely to create a reaction. And the big 7, right, are cow's milk, egg, fish, shellfish, tree nuts, peanuts.
I think there's 9.
Oh, 9. The 2 more.
wheat, soy, and
So it's have to be
sesame.
maybe
With soy 70.
I can't count.
It's good that we wrote it down.
Yes, and it's really changed since we started in this field. It used to be like, oh, be careful, don't give these foods to kids, and then we
Right.
started to be like, wait, the rest of the world doesn't have food allergy problems like we do here. Maybe we should expose them earlier.
And that has been really helpful. Like, we started, that recommendation was made like between 10 and 15 years ago from some really good studies. Again, people actually do study this stuff.
Yeah.
And there's some great studies that we actually then change recommendations based on. And so this was a big one that all of us were like, oh, we need to start doing this earlier. And we have noticed a significant reduction in pediatric food allergies since we made these recommendations. Now, you notice like all of these, they're not going to be able to do all of this at 4 months.
No, they're not.
But the idea is that if you start some of these just tastes, like even tastes of food, you're getting that allergen exposure in. And as they get bigger, like if you start early, then you actually are able to get more and more in.
Yeah.
Yeah. And I say for peanuts, I always recommend PB powder, which is that ground stuff you put in the smoothie.
Oh, yeah.
Because you can just mix it in cereal.
Yeah,
And then it's not very, it's not too much texture.
Yeah, they get the exposure, but they don't need the texture, and they
Right.
don't need the stickiness of the peanut butter.
Yeah.
So it also used to be a recommendation to wait 3 days between trying new foods. Like,
don't recommend that.
Talk about no science, right? It was just random,
What was this idea of like, oh, if they get exposed, then we're going to see if they have an allergy or how much they like something. And I'm like, actually, you know pretty fast if they have an allergy
Yeah.
to something.
Yes.
Like within a half an hour, they're going to get hives or start vomiting or like.
It's not subtle. It's
It is
head
not
to toe
subtle.
rash, some kind of GI reaction, and you're going to give them a dose of Benadryl syrup, and that will help the hives and the GI. And usually that's it. First reaction, they get over it pretty quick after the Benadryl.
But don't give it again.
No, but then we say we're not going to give you that one again until after
until-
H2, after we've either blood tested or skin tested to see if you're still going to have a reaction.
Yes. So that's kind of what we kind of recommend for allergies now. But the big thing is that you're like kind of changing, like, initially you're eating these mashed, pureed, strained fruits, and then you're kind of increasing textures, thicker, lumpier, like all that type of thing. And it's it's a developmental thing.
And it's funny when you feed babies, sometimes they have crazy facial expressions, right? Because they're like figuring out this stuff,
Yeah,
right?
what
And
is
someone was like,
this?
never read the face. Just if they're still looking at you and still interested, keep going. If they look away, well, they're probably done. But it's just funny, the faces of they're like, what is this?
And it takes multiple exposures for them to decide if they like things. Babies have so many taste buds, more than they will ever have in the entire life.
Yeah.
They have as infants.
They're
and so
super
it
tasters.
does take a while to figure out, like, oh yeah, I do like that, right?
Yeah,
like,
I recognize this.
yeah, like this is cool.
It might not even be I like it. It might just be like, oh, I know what it is.
Yeah.
It's
Yeah.
food. Yes.
But before that, they don't know, and so
No.
you don't need to like start with vegetables first. Like truthfully, it's all new to them.
Yeah, it's all new. It does not matter. Giving your child fruit for several days before ever giving them vegetables isn't going to decrease their ability to eat vegetables.
And
No.
just mix it up. Make it interesting,
up.
right? And things that you eat at home, that's what you want your kid to eat.
Yeah, but maybe one new food a day, sometimes even 2 new foods a day is fine.
Yeah.
But when you do the allergens, those top 9 or 10 or 7, however many there are,
You guys can count at home.
when you do those, maybe have that be the only new food.
That day.
Yeah, that
Yeah.
day.
Yeah.
Yeah.
And I think that's actually really smart. If you're doing 2 new foods and one of them is an allergen, in that first, like in that same meal, it does then get kind of, ooh, I don't
Yeah,
know what
you don't
I
know
did.
which one
So
it was.
only one, if you're doing the allergens, that should be the only new food you give that day.
And kind of the puree moving on to more lumpy is baby dependent too. Some babies can move quickly to like more tabley food stuff. Some are like, go slower. I'm just getting too nervous. And that is your kid's personality. That's their disposition. So just be patient with them. But if they want more, you can go to more lumpy things.
Yeah.
And then we do start water in a cup at 6 months, not before that, because babies don't need when they're under 6 months old free water, and in fact, it's actually not very good for their kidneys. Kidneys don't respond really well to free waters in that less than 6 months. But after 6 months, you can actually even start doing a little water in a cup. They're not good at it.
No.
Again, developmentally, they're just practicing.
Here, can you demonstrate what will happen?
Yes. But, like
It's fun.
like everything else, you just got to practice. So eventually they can do it. And they do not need juice. Juice is basically candy, right? And
Candy
so-
in a cup.
Candy in a cup that they are not craving it. Nutritionally, it doesn't add anything. Fruit is what's important because that's got the vitamins, minerals, and fiber.
And it has the fiber, yeah. So breast milk or formula in the cup is also okay in very small quantities while they're learning. They don't need to have 6 ounces of milk in a
And they won't
cup,
again,
breast
they won't
milk
be able to
formula.
drink it.
They won't be able to drink that much. They need a little bit. And I really like the idea of introducing the milk in a cup because sometimes, you know, when you're trying to take the bottle away from the baby and it's time for them to be done at 1 year, when you want them to be done with bottles, you still want them to drink milk.
Right.
And so sometimes they associate the milk with the bottle, and when they're done with the bottle, they never touch milk again.
Yeah.
Right.
So-
So it is an important.
It is. Not only white, only clear things don't come in a cup. You can have white things in a cup too.
Right.
It's fine.
Right.
And then baby-led weaning's kind of become like in the last 10 years, a thing.
Yeah. And it's really like it's a kind of a social media sensation, the whole bit about baby-led weaning. And really, you know, there's not a strict definition of what is it. And so people hear the words and they think, oh, well, it's this or this, that. And they apply a lot of their own rules to it. But really, baby-led weaning is just complementary feeding.
It is.
You know, and it can include a range of textures and foods. And there's really no evidence that quote unquote baby-led weaning results in better nutrient intake or better growth or dietary habits later in life, or that it helps to prevent obesity. That there's no empirical evidence of like that.
I think the important part about baby-led weaning is that it is exposing babies to that wide variety of food and textures.
Absolutely.
Which we fully endorse that part.
We do.
Yes.
Absolutely. Fully endorse that part. With a combination of spoon feeding, self-feeding, can actually really be quite helpful.
It's supposed to be messy.
It
Eating
is
is supposed to be messy. Let the babies get their hands in the food and enjoy it.
Yeah.
My part about the baby-led weaning, I've always had a lot of problems. Well, there's two. One, it's weaning in the name, which I actually don't want them to wean off of breast milk.
Keep going
or
with the breast milk to their
formula
birthday.
in that, you know, that second 6 months. Like, they still need that. And then, secondly, is that it can have the potential for choking hazards depending on how you do it. And this has been like, we've actually had some of these things
Right.
happen. And
In the
so,
clinic.
In the clinic.
You've seen the kids choke in the clinic. You're like, what are you feeding your baby? Oh my gosh, that's not good. Now it's done.
It is a
That's
little
a
scary. And
stake.
truthfully, it's scary for us too. Like, it's scary for parents. It's scary for us. Like,
Yeah.
you know, like, so, and I really, this is one of my big anticipatory guidance, like, safety issues for babies is that, again, you need to be watching really carefully when you're feeding your baby, and making sure that they are developmentally ready for that type
For the
of
next
food.
texture. Yeah, I mean, textures have to kind of progress over time.
Yeah, but that doesn't mean they can't do like the taste and textures thing. Like, exposing them is awesome.
Oh, yeah.
Yeah.
And so from 4 to 7 months, you know, that's kind of when you're going to get this started.
Right.
And then from 7 to 10 months, this is when it's going to really like ramp up all the different kinds of foods and like trying several new kinds of foods a week and seeing if you can get them to 100 different foods by the time they're
Awesome goal.
by the time they're
I can't
one.
think of 100
By the
foods.
time they're one, I know, I'm like, whoa, that is so impressive. I do like to, like, as you're introducing these new food groups, right, especially in that 7 to 10 month range, is when you're really going to expand. Because, you know, in the, and really the 4 to 7, or really the 6 to 7, if you're waiting a little bit longer, or your baby needs to wait a little bit longer, that's only a month, right? So a lot of times you're giving those early foods, like trying to do new ones, but you're not going to get really into
A ton of variety.
A ton of
Complex
variety.
foods.
Yeah.
But by the time they're 7 or 8 months old, they can really do a lot of different things, like from different food groups. They should be doing infant cereals, fruits, vegetables, grains, yogurts, cheeses, meats, proteins, like.
When parents ask me, what should I feed them? I was like, it's easier to tell you what not to feed them.
That's right.
You can pretty much do anything from your plate that you can smush, right?
Yeah.
It's okay to have some spice exposure.
I love that.
I know, like, because I really want them to eat your food someday. So expose them to your food, right?
Yes.
And they can pick it up.
Yes, and smush it all over their face. This is like 3 bath a day kind of days, you know?
You don't need extra salts and things, but like your spices, the things that you're already using in your food and that you're like you can mash up for them, that is awesome at this age, that 7 to 10 age. Again, that's how you get to that 100 different foods, right?
Right,
And,
right.
You know, can we start 1 meal a day at that 4 to 6 months, and then your goal is to get up to 3 meals a day, like breakfast, lunch, dinner, by 9 months, with a cup each time with some water in there. But
Yeah.
again, some babies get there super fast, some babies take their time. That's okay.
I wanted to talk also about the high chair, the importance of a high chair,
Yeah.
and having the baby in the high chair with the rest of the family
Right.
while everybody is eating, so they can see what everybody else is doing, and they have the opportunity to put their hands in the food, bring it to their mouth, lick it, make faces, spit it out, you know.
And talk, right?
And talk.
And this is like when babies are really, you know, more vocal is when everybody's there and at mealtime and
everybody
sharing
else
the
is talking
conversation,
too,
right?
Like, it's fun. This
Yeah.
is, again, supposed to be a family enjoyable
And they
thing.
do crazy things and make people laugh, and then they just keep doing those crazy things because it makes people
Yeah.
laugh, right?
And then by 10 to 12 months, you're actually now changing, right? Like this is where you are going to see that obvious decrease in nursing or formula intake, and you should. Like that's actually an important
The
part
goal
of it.
is actually
The
to
goal is
decrease.
that then by the time they're 12 months, most calories are coming from food, not your nursing
milk.
or formula. And so that when you do switch to milk at 12 months, like that's not a problem, right? So by 12 months, they're only typically they should be only taking, your with a formula like 16 to 20 ounces a day.
Right. And kind of nursing about 3 times a day.
Yeah, and food offers the other 80% of intake, right? So, but that's our goal by 12 months. And so that 10 to 12 months, again, is that really important part of getting into that schedule of eating 3 meals, like maybe even adding a snack in there so that by the time they're 12 months, they're getting 3 meals, 2 snacks a day.
Right.
Yeah, and what kind of snacks do you recommend for older infants?
For older infants, well, they have a lot of ability to, you can give an older infant string cheese,
Yeah.
you know, peel it a little bit and then they can eat it like this. They can eat all kinds of fruits. It's still better to have the fruits that are more soft, maybe even a little bit cooked, like if it's an apple, maybe it's cooked a little bit so it's a little bit soft, so
little bit
because you
mushy.
don't want them biting off a chunk of apple and then,
Yeah.
so a little bit soft
And
apple.
then again, even with
Berries.
snacks, they should be seated at a table. Don't like let your
Roam
roam
around.
around with food.
No roaming.
It really increases your chance of choking, but actually it's just really not good for
It's not good for them, and you'll get ants and roaches if you live in that kind of place. Yeah,
That's true.
Live in a place here where there's a lot of fruit and
yeah.
a lot of ants. Yeah.
Yeah.
The other thing I always mention in this age range is I like to call it the chipmunk phase. So especially when they're feeding themselves, they're like so excited by it that like
Yeah.
literally if you put like all these like a bunch of things on the thing, they'll just like
Yeah.
and then like they have these chipmunks and then they'll try to swallow.
Yeah.
Guess what?
They're going to choke.
They're gonna choke.
Yeah.
Like, so-
Taste the baby.
yeah, again, this is where you help look at those baby cues and like you
Get off
know,
your phone.
yeah,
Yes.
you watch your baby eat. So
A
that
lot of
you can-
attention when they're
a
in the
lot of
high
attention.
chair.
Even when they're older and eating a lot of stuff themselves, you still have to pay attention.
Yeah, but I think there's a lot to be said for just slowing them down enough to sit in the high chair and being there with them while they're doing that, you know, like a bite for me, a bite for you, you know, you feed mommy, I'll feed you, you know.
Yeah.
That
That's a great
it's,
idea.
It's kind of nice because you need to slow down. We don't need to be running around and eating all the time.
And then how about how about feeding at night?
Ah,
Should we be feeding at night at all? Like breast
By 10 to
milk,
12 months?
formula, milk, anything, or food during the nighttime by 12 months.
no.
Yeah.
No.
So
I mean,
early on when they're infants, right? Like again, like even by 6 months, some babies are only going to give you like 6 to 8 hours at night, but they should start at least giving you like that 6 to 8 hours. And then a lot of other babies, then once they're older by 12 months, they're able to sleep through the night without requiring food. They do not need it because they're hungry.
No. And you know, babies have dreams.
Yeah,
You know?
right.
And so sometimes
dreams.
you might need to go in and pat them and say, it's okay, shush, shush, shush. And then they go back to sleep. And then, right? That's
Right.
what they
That's right.
do?
Right, and that's what we really work on, like the putting to bed at night, trying to make sure you're not feeding them to the point of they're asleep, because then they don't know how to fall asleep by themselves. Like,
Right.
really try to separate that, to feed them, especially if they have teeth, go brush their teeth after they
Yes.
Right.
feed,
Yeah.
and then do something soothing, talk to them, saying prayers, whatever is comfortable
Read a
to
story.
you. So it's the last thing they remember. So if they wake up at night, you're like, I got some skills. I can do these things. We don't have to feed, right? We already built something in there.
Food during the day.
Right.
So
Because even if they are hungry, feed them more tomorrow, right?
Yes.
Yeah.
And if they're waking up in the night consistently because they're hungry, then they need to eat more during the day.
Yes.
Right.
Which they probably will be happy to
Yeah.
do.
Yeah.
And then by 12 months, they can start cow's milk or your other forms of milk that are again fortified, but no cow's milk before 12 months.
So you can do cow's milk products, like
Yes.
kind of, if we
A
say
little bit
string
of cheese,
yogurt.
yogurt.
Those are nice high-fat foods that are easy to eat.
But cow's milk itself puts them at risk for intestinal bleeding. It has way too many proteins and minerals for babies' kidneys under 12 months of age, and it really doesn't have enough of the right nutrients that your baby needs to grow in that first year of life. So hold off on your milk, like pure milk products, until after 12 months.
Okay. Do you have a lot of patients who want to give their kids cow's milk before they're a year?
So actually, it's one of the things that we run into a lot is that, like, we talked about like the weaning, like sometimes a lot of babies will self-wean like around 7 or 8 months, right? And then, but moms really don't want to go to formula. And so like, well, can we just go to cow's milk and, or milk of another thing? And we're like, no, actually the formula really is still important, for growth and with respect to what nutrients you need. And it's just, cow's milk is too harsh in that baby's tummy,
Right.
before 12 months. So.
Yeah. Okay.
Okay.
I just wondered.
That's the time I usually get it is
Yes.
that
Right.
we're just trying to like,
It seems a cheaper way out to say, let's do milk. And we're like, no, they still need formula after their birthday.
Yeah.
So,
until
we talked about, like, these are the things that you can do, but here's the things we say don't do before a year. So, no honey before a year. You're at the risk of botulism.
then no foods with added sugars. So like, again, like if you're like cooking stuff and you're like making something that everybody's eating, if you want to mash that up good, but they don't need muffins.
No, muffin's just cake.
Yeah.
It's just cake by the another name.
Cookies
right?
or flavored yogurts. Like they don't need those.
No.
Yeah.
Cookies.
Yeah.
They don't need baby
No.
cookies.
No.
Puffs.
No.
They don't really need baby puffs.
No, baby puffs are just Cheetos.
They probably taste a little better.
The list
though,
of
and they don't stain your
ingredients.
fingers.
The list of ingredients is very long.
Yes.
Very
That's
long.
right. So again, not foods with added sugars. That doesn't mean you can't give them cake
On
at
their birthday. They should have some
Like-
kind of cake on their birthday. And it can be a good tasting cake, not like just a all natural, not fun cake.
But on a regular basis, we don't offer added sugars. And then no foods that are really high in salt.
Right.
Um,
They don't need that.
Yeah, so like a lot of your processed foods, or canned foods often have
Hot dogs.
Hot dogs, yeah.
Hot dogs are not so healthy.
And plus they you choke on them. So
Right.
Don't do those for lots.
But
of
again, the
different
foods
reasons.
you are making, if they're a little bit salty, totally fine. If you're eating it, baby can too. But don't, head out for some processed meats just for the baby. They do not need it. Fish that are high in mercury, all of us should kind of avoid large exposure to those, but especially kids
Yeah, and pregnant women.
and pregnant women.
Yeah.
And they're kind of the bottom feeder fish.
Yeah,
right?
they're the ocean fish, the big ocean fish, and we don't typically eat swordfish and shark
In the
around
gorge, yeah.
here anyway. The fish that we usually eat, like the salmon and the tilapia and even cod, those are safe. Those are not.
Yeah, and fish is a really good food for babies. You can smush it down as long as there's not bones in it. You can smush it down.
flakes off.
um,
It's really like easy
really
to pick
nice,
up. It's
yeah.
really nice.
You can make a little fish paste. They're all for it.
Yeah, and the reason you don't want to do that is because it does have higher mercury, which really can affect brain development for babies. So we just kind of, recommend not doing that. The other big recommendation that I have, no unpasteurized foods or drinks.
No, absolutely a risk for death for kids.
Yes, and I know that there's been this push, and they say that sometimes these things are more healthy. They're really not. There are no better nutrients in unpasteurized milk or juices than you will get in pasteurized. Pasteurization does not eliminate good, healthy nutrients.
No, it
from
eliminates
these
the
foods.
bacteria that will kill you.
That is all it does.
And again, kids have more chance of dying from one of these because their guts, their microbiome is a lot smaller. They cannot process it as an adult can.
And it only takes a tiny bit for kids to get sick from this. Sometimes it would take more for an adult to get sick, but even adults will get sick from this. So no unpasteurized juice, no unpasteurized milk, often called raw milk, no unpasteurized yogurt or unpasteurized cheeses. They do not need it.
They don't need it.
Yeah. So next we're talking about toddlers. Now
Before that, I just wanted to have Melody kind
Oh,
of
yeah.
talk about the absolute things to
Okay,
avoid.
These are the
Summary
red
of the
line
first year.
things, okay? Please don't do these things. Do not prop your baby's bottle.
No.
They need to be held in the arms, and they don't ever need to hold their own bottle. Don't put the bottle in their crib. Don't put food in their bottle.
No,
That's right. Especially some people will put cereal in to make them sleep longer. That actually has been really proven to cause things like obesity.
Yeah. Don't put cow's milk. By the time they're ready to drink cow's milk, they're also ready to use a cup all the time.
Right.
They don't need a bottle for cow's milk. Don't get into the habit of nursing the baby all night long because that also is really bad for their teeth.
And it makes them not eat during the day.
Right.
Right. And they don't understand the difference between being full and hungry.
Right. And so when a caretaker ignores the cues that they're getting from the baby, like when the baby is turning their head away from the breast or the bottle or pushing away the spoon, that is the baby telling you, I don't want that, I don't need that, I'm not hungry anymore. So pay attention to those cues. And if you watch videos of people feeding infants, you'll see this happening, and it's pretty, the baby is trying to communicate this, and sometimes people are like, oh, no, there's still milk in there. Drink it. Come on, I don't want to waste it. And the other thing is, you don't want to allow free access to cups of milk and bottles of milk and juice and Gatorade and soda and things like that. In between meals, they should have water.
Yeah, and I think this is actually really important because we're going to talk a lot about toddlers and modeling behavior, but guess who buys this stuff? Babies do not go out and buy.
They don't have money.
Juice, right? Parents buy juice. So by buying that juice, we actually then expect our kids to drink it, right? Or if it's there.
They expect to drink it.
Right. They want to be like everyone else now.
Yeah, absolutely. And if there's a whole bunch of juice in the refrigerator, my toddler, once they open that thing, they're like, whoa, juice.
Right? And we talked about tripling that weight as a baby. Toddlers, this is when the rate of growth slows down.
Yes,
so
and
they
it's
don't
very much.
Supposed to, and so they don't need as much, and so they get to this what we call picky eating. It's really not picking; it's just decreasing the amount they're eating. So therefore, it's going to be one good meal a day.
Yeah, I call it the toddler variable diet. Some days it's good, some days it's bad. Some meals it's awesome. Some meals they barely eat.
Yeah.
That is a normal toddler diet, and they are not supposed to triple their weight. They're not supposed to gain a huge amount. Their weight and how much they gain in this next bit in toddler years is less.
Yeah, between ages 1 and 2, most kids will gain around 5 pounds. That's
high end of normal.
That's what you're supposed to gain.
Yeah. Right. Versus 15.
Yeah.
First year, right? Yeah.
So they have a much slower rate of growth. So they should be using a high chair still, or they should be sitting at a table for meals and snacks. That's where we have all our meals and snacks. We're not going to roam around the house with our granola bar or, whatever.
And they will refuse some foods they previously loved. In fact, sometimes they'll go through they'll be like, oh yeah, they're going to eat that food every day, or everything. And then next week you'll try that same food and they'll be like,
I want it.
I don't want it. And that's okay. Again,
it's totally normal.
Yeah.
And you're trying to get them to use utensils, but they're not going to be good at it. Still fine for them to make a mess and use their hands. Yeah. And obviously you're using just a cup, like I talked about, and not a bottle.
Yeah, I think it's important to remember to feed them a variety of foods from all the food groups and
Every
avoid
day.
every day.
Yeah.
And avoid feeding them only the things you know they like. Because if you know your kid likes chicken nuggets and you give your kid chicken nuggets every day because you know they like it, pretty soon that's all they're going to want to eat.
Well,
And-
and I mean, like, one of the big complaints I get from parents about food is like, I'm making my kids all different meals.
Oh, yeah.
I have 3 kids and I'm making them 3 different meals. And
Yes.
and my husband and I a different meal. And
Yeah.
I'm like, yeah, you shouldn't be doing
No.
that.
Crazy making.
Yeah,
that
it
is
is.
crazy
Like,
making.
that's nuts. Like,
No.
you will go nuts doing that.
But you know what? Part of it also is that when you have cooked something and somebody doesn't want it, it feels like rejection to the mother.
Yeah.
And it is really makes you feel bad as the mother when they don't want to eat what you made.
Yeah.
But it isn't them rejecting you, it's them rejecting the food. And that's typically because they're not hungry enough to eat it.
Right.
Because hunger's the best spice, right?
Yes.
When you get hungry enough, you will accept, foods that you never ate before, and they're going to taste good.
Yeah.
Right.
And that's what I mean, like, if you've made a meal and it has all the good things in it, then, and they don't eat any of it, that's okay. Then you're like, okay, that's
And
fine.
and again,
Stay at the table and
You still have to
socialize.
stay at the table and
meal
talk.
time is the
Yeah.
social time. It's not important what you eat there. It's what you do there, right?
Yeah.
There should be no devices at the table. There can be a couple fidget toys just to distract them, but then they should not be taking the place of eating.
That's right. And then once they're done, they're done. And then if they're hungry and like a little bit later, which means like 2 or 3 hours later when they would expect to be eating again, like 3 meals, 2 snacks means they're eating like
Every 2
during
to
the
3
day,
hours.
Every 2 to 3 hours
Yeah.
still.
Just like
Yeah.
we were as
2 to
babies,
3
right?
hours.
I would say for this age, you're safe to wait for 3 hours.
Yeah, for
Because
sure.
then they're going to get a little bit hungry.
Yeah.
Yeah.
And then they'll eat.
And then eating is a lot more enjoyable because they
Right.
want.
And
So
that's
what's
okay.
the golden rule of feeding toddlers?
Well, you tell us. You're like the expert here.
Whitney, do you know? The golden rule of feeding toddlers is you decide what they're going to eat, and then they decide how much they're going to eat or whether they're going to eat.
Yeah.
But you don't need to change your mind if you give them some broccoli and some rice and some chicken, and they're like, eat a couple bites of chicken, and then they don't want any more. You don't have to make them something else. You don't need to give them a quesadilla or a piece of pizza or some Cheetos. If that's all they wanted and they're done, then they
Yeah.
can socialize for 5 more minutes at the table, and then 3 hours later they'll
They'll be
probably want to eat some more.
Yeah, absolutely.
Yeah.
And it takes a lot of kindness, patience, consistency. So meaning you're going to do this every time. If like you break and say, oh my gosh, I need to give you like extra stuff right now.
Or
because
feed
you're
you right
starving."
here off the side of the
Right.
table.
Right.
Right.
Yeah.
Yeah.
Right. And let you run around with it. Right. Then that will be the expectation. Right.
They
So-
broke you.
That's right. They broke you.
You're
That-
creating normal.
Yeah, that's
When we
right.
talked about that before with parenting, you're creating normal.
That's
So-
right. So your expectations for them are actually important, and following that consistency is going to earn their trust, and make again eating and nutrition enjoyable instead of something that we have to do.
Yeah.
And milk's still part of their diet, but now it's not formula. It's not something with extra calories. It's going to fill them up and make them not want to eat. It's going to be either cow's milk formula or cow's milk, not formula, or perhaps an alternate milk.
Right. And there is actually, and it will not be as much. So like you will not, like often, especially with kids who have constipation or other issues, you might only be doing like, again, 3 servings of dairy a day, which might end up at like being like 12 to 18 ounces or, 16 ounces total. Some kids will drink up to like, or eat and drink up to like 20 ounces, but that's not going to be all the same kind often. So you don't have to have 20 ounces just of milk.
Right.
It can be other dairy products.
Yeah, yogurt is great food.
Yeah, exactly. And that's going to give them the protein they need, the calcium and vitamin D they need. Like you're getting all of those through that source.
Right.
So.
Yeah, it is hard to get enough calcium and vitamin D if you don't include any dairy products.
It is hard.
It's hard because there just are not a lot of food sources for calcium and vitamin D. Unless you want to eat sardines every day, you want to get your kid to eat a whole can of sardines
And
every day.
maybe they would. Who knows, right? 'Cause
maybe.
everybody has different tastes. What other milks do you recommend if, for some reason, cow's milk is not an option for the family?
I mean, soy milk is a good choice. Whatever kind of, if you're not going to use any kind of cow milk, then finding something that has the calcium and the vitamin D is what you want to look for.
Yeah, it has to be
So,
fortified.
and there are so many products that when you start reading the ingredients on the list of ingredients on the plant milks, you will really start to wonder, is this really better for me? I mean, maybe you have a cow milk allergy and that's why you have to avoid milk. That's legit. But, for other reasons, maybe, use maybe a low fat milk if it tastes better to you. There are so many different types of cow milk, the whole milk and then 2%, 1% and non-fat milk. And many people don't know that the only difference between those is how much fat is in it.
Right. And the
Yeah.
color of the cap.
Yes. And which is not consistent between stores.
I know.
Except
we
for
say
the
I drink
red.
the red milk. The red
Yeah.
milk's always the
The
whole
red one
right?
is the whole milk, yeah.
It is good. Fat is good in your diet. So you don't want to not have fat, especially for babies
Right.
and toddlers, because that actually does help a lot of brain growth options.
Yeah.
But
Yeah, your
again,
brain is made from fat.
It is.
Yeah.
Like
Look
all
at
those
those neurons, right?
Yeah.
Right.
They're all coated
So
in
yeah, if
fat.
you're not doing a whole fat milk,
Yeah.
then you just really make a conscious effort in the rest of the diet with avocados and
Yes.
peanut butter and oil and butter
Yeah.
and just get as much fat.
Right.
Like, yeah. But there's options of it. And then there are lots of things now. So, and if you do decide that you want to have a specific diet, whether that be, vegetarian or vegan, that your child will follow too, then it is really important that you supplement with those things that are going to be missing.
Yeah.
So find those things that have calcium, vitamin D, B12, folate, like iron, just making sure you're getting all of that in your infant's diet.
Yeah.
And that will be harder work.
Yeah, and if you're not sure how to do it, then go and see a nutritionist.
Yeah.
Because
Go see. We'll refer you.
we can figure it out for you just to make sure that you're getting the balance that you need so that you stay healthy.
Yeah, because that is really important at this age. So, and then what about toddler formulas? There's a lot of
We talked about that. Yeah,
toddler
no
formulas.
formula with extra calories, right? Because you already have a kid that's only eating one meal a day. Don't make that meal be the formula they're going to drink.
And that often these are so filling that a lot of times this will be the only thing they eat or drink. If you use toddler formulas, they are a marketing thing. There are a few specific medical formulas that, again, children who have medical reasons for needing them, and your doctor will tell you that. That's why these were initially created, and now it's become a big
industry.
A big industry.
It's a huge industry, and if you watch TV and you see the commercials for the toddler formulas, you will really feel like a bad parent if you don't give your kid that formula.
But they do not need it.
And they do not need it.
Yeah.
It's all just geared toward making money. So, yeah, you
And
can
the other-
avoid those.
The other thing I kind of think about is that you don't actually need a lot of to give vitamins if they're eating. Like if you're
Right.
trying part of a healthy diet,
Food
and
is
all
the
your
best
food groups-
vitamins, right?
Food is the best vitamins.
Yeah,
you
your
don't
body likes
need
it better.
extra,
Right.
unless they're not. Again, eating specific things. So if you do have a limited diet in some ways, then they may need extra.
Yeah.
And the goal is to ditch the bottle as soon as you can as a toddler. So between 12 and 15 months, because it becomes their best friend, right? Before they get emotionally attached to it.
Yeah, it is much harder the longer you go with a bottle. Like by the time, if they're still having a bottle by age 2, man, it is so hard to get rid
Yeah,
of.
they are really attached.
They
It's
are
terrible
really
for their
attached.
teeth, and it
It
lets
is.
them chug too fast, right?
Yeah.
Right.
And if you're still nursing and you both want to do it, keep on going. Just don't let it interrupt sleep or mealtime.
Yeah.
Right.
Breastfeeding is really good for babies up until age 2. There are nutritional benefits up until age 2. After age 2, some people decide to keep breastfeeding, and that's okay. But it's more of an emotional thing at that point.
Right.
You know, it's not so much for nutrients.
And the big choking hazard foods, the ones you want to avoid, chips, and we should just avoid chips anyway. What do they have? Nutrition. Popcorn, whole nuts. It's definitely okay to have like the butters or kind of crushed nuts, but you don't want to have the whole nuts. Your favorite?
Oh yeah.
Hot dogs.
Hot
No.
dogs.
Bad choking.
Never hot dog.
Whole grapes. You can cut grapes in half though, or even in quarters, and that
Yeah,
works.
those are
Love
totally
it.
fine.
Yeah. Raw vegetables.
Again, cutting them up so that they can't choke on them, but they are not going to be able to chew those very well. Often you don't, like, you have one set of molars that you get like around one, and then that second set don't come in until two. Like they don't have a ton of chewing capacity.
Right. And again, they don't pace themselves well, right? And so you're like, you have to have foods that that could be chewed small and into small pieces.
Right.
Okay, and I think we talked about keep on doing variety of foods, right? And how do you know a toddler's eating enough?
Are they growing?
Yes.
You know, what do they look like on the growth chart?
Right.
Are
See
they
your doctor?
See your doctor.
Go to those well visits. Those
Go
are
to the
actually
well
really
visit.
important.
Yeah, they're
Yeah.
really important. You get a lot of good information, and it's a great time for early screening of things that maybe aren't going the way it's supposed to be going. Yeah.
Are they really have a lot of energy and curious and developing normally? All of those imply that they actually are gaining weight and doing
Right.
well.
They should be happy. They should also be able to throw a tantrum that uses a lot of energy.
It's a good marker of like,
it's a
yes,
good
I'm
marker.
feeding them enough. Look at
They have the
tantrum they can
energy to
throw.
do that, then they're probably all right.
Yes.
And if they aren't doing those things, that is when you absolutely go and talk to your doctor about it. And guess what? We'll probably refer you to Melody.
If you have any problems, right?
That's great. I would love to see you in the office. I work with your whole family.
The other thing I do want to just have a quick thing on is, does food have to be organic?
No, of course not. It does not have to be organic. It's important to eat as many different vegetables and fruits as you can, because of fiber and because of the effect on the microbiome but food needs to be washed before you eat it. All fruits and vegetables need to be washed, whether it's organic or not. But organic food means that it's grown typically without pesticides or herbicides, things like that. As long as you're getting a really good variety of vegetables and fruits, it doesn't matter that much.
And the
If it's
organic label is become a little slippy. in
Yeah,
here.
it's slippy and it's very expensive.
It's very expensive. And I really do get a lot of parents who feel guilty if they're not doing this. And and I just say, don't have to be organic, just healthy.
Right.
Like picking those like fruits and vegetables, washing them, making sure you're cooking with them. Those are actually your most important part, offering all of those options. Paying double or triple for organic means that you might not be able to offer other
As
types
much
of,
or as much.
or as much of other foods, right? So again, don't feel guilty about this. There's no reason. If you're offering your child a really varied, healthy diet, that is the most important part.
Yeah.
For sure.
Yeah.
And modeling good behavior.
Yes.
You eat the things too. Don't just buy them
Yes.
for them. You
That's
eat them
right.
with them, right?
Right, exactly. Like really model that healthy behavior and eating. Again, sitting with them to eat and drink, making it a social, and so they can see you and your other children eating.
Right.
Like that's huge for kids.
Taking the
like,
time to try
yeah.
new foods, to talk about it. Is it crunchy? Is it slippery? Is it, is it salty? Is it hot? Is it spicy?
Yeah, try
Give them
those,
the vocabulary.
Try those new foods. And if you don't like a lot of foods, then at least try some yourself occasionally. Like you'll
Expand your
occasionally get the
horizon.
parent who like won't eat anything either, and I'm like, it's still good for you to try.
Right.
And guess what?
Yeah.
You don't have nearly the taste
Taste
buds you
buds,
had
you
when
barely
you were
get.
little.
If you drink coffee, you can eat almost any food, right? Like,
So that's
It's true.
always really important. And then think about their drinks. No added sugar, no juice. Really it is water, milk, and your fortified
And water.
soy or
water
other
and milk
milks.
and water.
Right. Yeah, and so those are your things. And then I always just put anything really, again, watch your child while they eat to prevent choking.
For sure.
Um, And then the last thing is get kids involved.
Right.
Oh yeah, kids
Toddlers
love to
love
cook.
put
They
stuff
love
on
getting
the-
in.
Yeah.
Mhm.
Put things on the plate. make a little
Shopping,
design.
cooking, like
They're not always
have them
helpful in the
bitch.
grocery
Oh my
store,
gosh,
but you should
horribly.
try to have them involved.
Well, you can
Sometimes I
teach
get
them
to
about
check out
food.
with my son and be like, I didn't put that in there.
Yeah.
That has to go back. I'm sorry. But we hope all of these things help you keep your child safe, happy, and healthy, and sane.
And sane. That's so
sane,
important. We need some
Yeah.
sanity right now.
When
Sanity.
you think about nutrition.
Yeah,
So,
I'm Dr. Joanne Smith.
and I'm Dr. Corinna Hankins,
And I'm Melody Acosta.
and this is a
Pod full of pediatrics.
Thank you for listening.